In 1992, I started a ARNP owned, operated, managed outpatient rural psychiatric clinic in Eastern Washington. And my specialty is working with patients with schizophrenia. In particular, people with schizophrenia that really could talk about their symptoms, had no problem taking medications, being part of the program. But when it came to a job interview, when it came to moving forward, there was just a lot of fear. So I started asking some of these individuals, tell me about why it's so hard to go for a job interview, why it's so hard to think about going back to school. Help me understand that. And I would hear all the time, I'm afraid, I'm afraid. What if I say something wrong? What if I end up back in the hospital? I was so concerned because there was something that I didn't seem to be capturing. This young man, he was 24, he had written, he said, Mary, how would you like to know you went so crazy that your parents called the cops? They come to your neighborhood with the cop car, fire engines, rescue squad, sirens blazing. They haul you out of your house with handcuffs on. The neighbors are watching, throw you in a cop car, take you to a mental ward, drug you up, then send you home. And you're supposed to put your shoes on and walk back out your front door knowing what your neighbors saw. When I read this, I thought, oh my goodness, I've never thought about it like that. So I thought, my goodness, this is all about adjustment. And then I thought, how would somebody adjust? How would you deal inside yourself with exactly what this young man wrote? No one had studied adjustment to psychosis and what that means to the individual as well as their family. And I went to Case Western Reserve University and got the Doctor of Nursing Practice degree and studied post-psychotic adjustment and did my original sample through the EASA program in Salem. And it was absolutely remarkable what I learned. So the individuals that were part of the study were very open with the pain and the suffering and the shame and the guilt and everything that goes on inside that nobody had ever really asked them to talk about before. So that's the background for what became the Milestones of Adjustment Post-Psychosis recovery model. Well, the 4 phases are named the couch, the bus depot, the mall, and back to work. So in the first phase, cognitive dissonance, the person is on the couch. And you hear families complain a great deal that when a person gets out of the hospital or after they've had an episode, if they were managing it at home, they just don't get off the couch, they don't come out of their bedroom. And what I learned from these participants was this is a very intensive personal time. Like, what the heck just happened to me? In the second phase, in Insight, I called this phase at the bus depot. At the bus depot phase is a time in which the consumer learns how to be around people while they're experiencing chaos, still with symptoms, but want a need to be around people. So they sort of practice talking a little bit, but not really initiating conversation. Then the third phase, I call at the mall. So the participants talked about, yeah, finally I felt ready to go to the mall. So, okay, well, so tell me about the mall. Well, the mall, you know, it's light, people can see you, you go there to buy something, and it's really scary because if you do it wrong, maybe they'll call the mall police and you'll end up back in the hospital. Each person had to try different things out. For one of the young girls, she said it was when she was able to go to church with her grandmother. Because so church was her mall, where she knew she was going to be talking to people and she wanted to be able to do that correctly. So then the fourth phase is going to work. And in this phase, that's where the participant is now ready to think about a job interview, to think about going back to school, to getting engaged with normal life, wanting a relationship, wanting their own place to live. So if we think about emotionally going from anger, fear, shame to going out into public, that's huge. We think about not wanting to be around people to now thinking about going for a job interview, to not being able to answer a question other than yes, no, to initiating complicated interactions that are needed to be in this world. So those are the 4 phases and some of the key milestones.